The Nclex Pn examination. Each jurisdiction requires a candidate, someone who has graduated from a reputable nursing program, to pass an examination that measures the competencies needed to practice safely and effectively as a newly licensed entry-level LPN. Licensure examination, again, is a means of protecting the public. The boards are the only agencies that can both license a candidate and release the results to him or her. The Nclex Pn examination is updated about every 3 years using the steps that are listed here. Endorsement application information is located in every Nurse Practice Act for the state in which you are seeking to be endorsed in. The ncsbn.org provides more information on the Nclex test plans, which serve as the blueprint that outlines the content to be tested. It is important when you're studying for any content in a nursing program to review this information, but especially when studying for the Nclex Pn examination. When you sit down to take your Nclex examination, you'll be provided a short tutorial on the question types that may be included within the test. The ncsbn.org also has information on different question types, so you can look at that ahead of time. There are 4 major divisions of patient needs on the Nclex Pn. Patient needs provide an overall structure for defining nursing actions and competencies for a variety of patients in many settings and are in agreement with state laws and statutes. Under safe, effective care environment, this includes coordinated care. It is 16 to 22% of test items, and examples will include advanced directives, client rights, management or supervision, confidentiality, legal responsibilities, and ethical practice. Safety and infection control comprise 8 to 14% of test items. For example, accident or error prevention, handling hazardous or infectious materials, medical and surgical asepsis, standard and other precautions, and the use of restraints. Under health promotion and maintenance, this is 6 to 12% of test items. Included in that is growth and development throughout the lifespan. Examples would be the aging process, antepartum, intrapartum, or postpartum, along with newborn care, developmental stages and transitions, family planning, and human sexuality. And prevention and early detection of disease. Some examples would be data collection techniques, disease prevention, immunization, and lifestyle choices. Under psychosocial integrity, that would be 6 to 12% of test items. It includes coping and adaptation with examples of behavior management, coping mechanisms, end-of-life issues, mental health concepts, religious and spiritual influences, and therapeutic communication. Psychosocial adaptation examples would be abuse and neglect, chemical dependency, crisis intervention, mental health concepts, suicide, therapeutic environment, and behavioral interventions. And physiological integrity. There's 4 categories under this, including basic care and comfort, which will be 6 to 12% of test items. Examples would be assistive devices, elimination, hygiene, non-pharmacological pain intervention, nutrition, and sleep. Pharmacological therapies comprise 13 to 19% of test items, and examples include adverse and expected effects, administration actions, and side effects. Reduction of risk potential would be 10 to 16% of test items. Examples would be potential for alterations in body systems, lab values, diagnostic tests, and potential complications. Physiological adaptation is 11 to 17% of test items. Examples include basic pathophys, fluid and electrolyte imbalances, medical emergencies, and radiation therapy. With the clinical problem-solving process, remember this is a scientific approach to patient care. It includes data collection, planning, implementation, and evaluation. With caring, this is the interaction with clients, families, and others in an atmosphere of trust and respect. Communication and documentation is verbal and nonverbal communication with the client and those that are involved with care. Documentation, written or electronic, of all events and activities that may be associated with the client's care. Teaching and learning is assisting the client to gain information, skills, and attitudes that hopefully lead to a change in behavior. So the application process. You need to go to the Pearson website at www.pearsonvue.com/Nclex. Complete all the eligibility requirements for licensure. WATC will notify the State Board of Nursing when you have fulfilled your educational requirements, and they're usually pretty prompt at doing this. You will then apply to the State Board of Nursing, and you will obtain an Nclex examination candidate bulletin. The State Board will notify Pearson VUE, Pearson Professional Testing Center, that all of your requirements have been met. All boards will ask a candidate about previous criminal activity, such as felonies and misdemeanors, and the board will decide if it influences your ability to be licensed. You must be truthful. Hopefully you have already been upfront about this, and the State Board and the school program is aware of any issues that you may have. You will then mail your registration form to Pearson Center. You can use the internet, you can use snail mail, or the telephone to register. Pearson VUE will confirm the receipt of registration and send an authorization to test, ATT, to the candidate. If that ATT does not arrive within 2 weeks, you need to call Pearson VUE at the appropriate number listed on the front section of the candidate bulletin. Once the ATT is received, you'll schedule an appointment to test within the validity dates printed on the ATT at any approved Pearson Professional Center. The time limit for all Nclex Pn examination registrations is 365 days. Validity dates for ATT will not be extended for any reason. Once approved for testing, the candidate must take the Nclex Pn examination within the approved time frame. Make sure that you take your Nclex Pn examination on the scheduled day. Failure to arrive at the test site will result in Pearson reporting the student to the State Board, and you forfeit your registration. The State Board of Nursing will notify you of your test results, and these results are usually available within 48 to 72 hours after testing by phone or internet. But it is not recommended that you call the State Board of Nursing, the Nclex Candidate Services, the Pearson Centers, or NCSBN for results. Even though while you're testing, the computer continuously computes the result of your answers while testing, the Pearson Center will not release final results to you directly. There are several fees that are required for application and testing, and Each fee is going to be a little bit different depending on geography. When you arrive for your Nclex Pn examination, you should arrive at the testing center 30 minutes early. Use your name in the exact format as when you applied for the Nclex Pn examination. Bring 2 forms of identification that have your photo and signature. Bring your authorization to test. Fingerprints, photograph, and signature will be done when you arrive. They accompany your examination results that are sent to the board, and they can be used to confirm your identity. Test takers are observed and recorded while testing through direct observation by the staff, as well as video and audio recording during the entire examination. Your personal belongings will be secured outside. A Pearson staff person will escort you into a secure area. The computer that you will be using includes both a calculator and a time device that tells you how much time remains to complete your Nclex Pn examination. You will be provided erasable note boards for the use during the test, and they are collected before you leave the room at the end of testing. Leaving the room is allowed with permission only. Any irregular behavior during testing can result in criminal prosecution, civil liability, and/or disciplinary action by the Nursing Licensing Board. Individuals taking the test are fingerprinted each time they return to the testing area after a break. While you're taking the test, if the computer seems to be malfunctioning during the testing time, ask for assistance with the computer. During the testing process, you use critical thinking, the nursing process, and basic nursing knowledge as you do in the real world of nursing. The computer will adapt the examination to your answer because the computer has a large number of test items stored in memory. As you answer the standardized items, the computer will choose the next best item to measure the test taker's competence. So basically, every test is going to be tailored to the test taker. Every question the candidate sees must be answered because the computer calculates each answer before it goes on to the next question. All candidates will answer a minimum of 85 items, and the maximum number of items any candidate will answer during the 5-hour maximum testing period is 205. Applying for a temporary permit, this is a permit that will allow a candidate to work as a graduate nurse. Now, that permit is revoked once the examination results are in, and passing the examination allows the candidate to work as a fully licensed practical or vocational nurse. If you fail the examination, then you go back to working as a nursing assistant. There are no longer graduate nurses in the state of Kansas, so temporary permits do not apply within Kansas.